CGTN, China Global Television Network.
It is a global pandemic of unprecedented scale, sparing no single territory on the face of the earth. Since being declared a pandemic in the second week of March, COVID-19 has now infected almost 1 million people as at this week, with over 47,000 deaths registered globally, according to the World Health Organization. Africa has so far suffered a relatively lower mortality rate compared to other regions in the world. However, the continent is increasingly coming to terms with the dangers of COVID-19. The disease threatens to outstretch Africa's health systems, even as authorities struggle to enforce safety measures in a vibrant yet unique social context. So, what challenges does the war on COVID-19 face in Africa? And how is the continent responding in the wake of this unforeseen public enemy? I'm Beatrice Marshall. Welcome to Talk Africa. And to help us assess the scale of COVID-19's impact on the continent, I'm now joined by our team of correspondents. In Cairo, Egypt, Adel Mahrour is joining us from there. In Lagos, Deji Badmus, and in Johannesburg, South Africa is Angelo Coppola. Gentlemen, thank you for joining us on Talk Africa. Now, Africa's situation regarding COVID-19 is still very fluid, although some cases are still on the rise in some countries. Now, let me start off by getting an understanding of what the situation is in your respective countries. And Adel, I'll start off with you because Cairo, at just over 50 people, has the highest mortality rate in Africa at the moment.
Yes, the numbers in Egypt have been growing almost every day and quite rapidly, but so far they have not been exponentially growing, which has kept the authorities quite confident with the measures that they're taking. There's a partial curfew imposed every day from 7 p.m. local time until 6 a.m. every morning. There is a full commercial lockdown during the weekends to make sure that people do not engage in public areas, shopping malls or shops, etc. So the government just have been announcing lately, though it has seen its biggest single-day growth on Wednesday, that it is still quite satisfied, but is urging everyone to move according to the government plans and abide to the staying at home and the curfew times as well.
Angelo, at just over 1,000 people, South Africa, though, has the highest number of infected cases on the continent. What is the current situation?
The situation at the moment is fairly stable in the sense that the trend seems to be moving in line with other world cities and countries' expectations. So it is moving upwards. We have had indications from the health minister that things are likely to get worse quite soon if we base the experiences of the other countries and what they've been through right now. So the situation will probably get more critical as we move into the cycle right now, Beatrice.
Deji, Nigeria was the first country on the continent to report a case around 27th of February. So what is the situation there?
Well, 3 states in the country are actually under lockdown, 2 as a matter of fact, and then the Federal Capital Territory, Abuja, and Lagos, for instance, where I am, is under lockdown. Then there's a neighboring state called Ogun. Now, apart from these 3 cities that are under lockdown, what is actually happening in the country at the moment is that for the rest of the states, we have 36 states in this country, the governors of these other states that are not officially under lockdown have actually pronounced their own local lockdown. So it's like the entire country is on a lockdown, because you go to other states that are not officially supposed to be under lockdown, people are not allowed to move. The NCDC here says it needs this lockdown to be able to trace at least 6,000 persons. So, well, the situation is not so bad, but what people are saying is that people fear that the reason why it would appear the number of cases here, confirmed cases here now is low, it's because we're not doing enough testing. So, you know, as the authorities now continue to ramp up their testing capacity, people fear that the numbers might go up, but we just have to wait and see. The jury is still out on that. Lagos, by the way, is the epicenter of the outbreak in Nigeria. The Lagos state government says more patients now will be discharged in the coming days.
Right, let's explore that a little bit, gentlemen, because as Deji points out, in Nigeria there is the feeling that the lower numbers are as a result of not enough testing on the continent. Adele, what are your thoughts on that, with Egypt having been one of the first countries that reported cases?
Egypt is moving quite quickly in one of the main aspects that has been so far helping it to control this epidemic from spreading wider, and it's what the WHO has been commending the Egyptian government in the efforts has done, and that's basically contact surveillance for the virus, which Egypt has been leading quite efficiently and quite remarkably, in the terms that most of the cases identified with COVID-19 in Egypt have not shown any indications, and that's the general case for Egypt so far. The mortality rate for Egyptians have been mainly because of the critical health conditions, with 100%, as stated by the health minister on Wednesday, 100% of those who have died with, all of them actually have been suffering from chronic diseases and respiratory issues prior to the infection itself. So in terms of movement to contain, this is what the Egyptian government has been leading with, and it's still proceeding. But now that the country has locked down its flight and locked down its ports in general, there's a new mission and a new challenge, and that is to control the virus from spreading domestically, and that might pose a bigger challenge for the government.
Angelo, South Africa has ramped up its testing procedures, though, because it has also announced that it could possibly be in a position now to test a lot of people in a span of results coming out in 45 minutes. What is the current position when it comes to testing in South Africa?
Well, besides the fact that the private healthcare facilities, the hospitals, private hospitals, are doing most of the testing right now, the public sector aren't doing 1/10 of the amount of testing. The health minister unveiled 67 mobile testing units that are being run by the National Health Laboratory Service. So those vehicles are going to be dispersed into the country. They'll be going to communities where they're currently identified hotspots to go and do some testing there. And that's on top of the 10,000 odd field workers that have also been deployed to go door to door to do scanning, and if they identify any symptoms, to then do swabs and then pass those swabs onto those mobile testing units. So when it's running efficiently, the health minister reckons that around 30,000 tests can be done in a 24-hour cycle, which is great news, because at the moment, obviously, that number is a lot less, because most of the testing is done in static environments like the hospitals, and then for verification, they have to go to the National Institute of Communicable Diseases. So as it stands right now, that testing will get ramped up and ramped up quickly, first to the hotspots and then to places where people have been traced that have been linked or associated or been in contact with people who have tested positively. So once they've done that, then they'll start moving into the general communities to do testing there. So the idea is the more testing that is done, the quicker it is to identify hotspots or potential hotspots, and then isolate those communities or those people. So the testing is going to be ramped up, and hopefully in the next week or so we'll see all of those 67 vehicles in the communities doing what they need to be doing. Beatrice.
Right, in terms of those hotspots though, Angelo, where in South Africa are the hotspots for COVID-19?
Well, Beatrice, as it stands right now, the highest number of infections is situated in the Gauteng province, which is also the smallest province, but also the most productive province. So Gauteng is the biggest, at the moment, epicenter. We know that there might be some issues in the Free State around that church where those 5 foreign nationals brought the infection with them and infected a church congregation. We have a case in the east of Johannesburg, for example, where one of those congregants is a nurse and came into the hospital, and an entire clinic has to be closed down now and everyone put on isolation there. So there's another hotspot. And then the Western Cape is a potential hotspot in terms of the number of infected cases, followed by KwaZulu-Natal province, which is in a distant third place. So we've got Gauteng, we've got the Western Cape, and we've got KwaZulu-Natal with that potential hotspot in the Free State around that church environment which saw those infected people. So at the moment, that's what we're looking at. We have seen relatively low incidence rates in the other provinces at the moment. Obviously, we want to see what's going to be happening up north, especially with the border between South Africa and Zimbabwe, and see if anything's happening there. But for now, Gauteng, the economic capital of South Africa, is that major hotspot.
Let's talk a bit about that whole question of challenges, because many governments across the continent have put in place measures to try and contain COVID-19, starting with curfews and starting with lockdowns. Adele, what is it looking like in Egypt, though, in terms of the partial lockdown? What are we seeing, and what kind of challenges are coming up for the Egyptians?
There has been resistance to the curfew. The Egyptian authorities have been roaming the streets all day long. They sound the sirens so that everyone would listen, but still there have been challenges for them to impose a fully abided by curfew, and that's one of the major challenges that Egypt is facing, and the government has been lately warning about. They have imposed a 4,000 Egyptian pound fine for anyone who breaches the curfew. That's around $250, so it's more than the monthly payment of an average Egyptian. Still, they're not seeing, or at least from the announcements, it doesn't seem that they're seeing the required response. There's also been an escalation in the punishment to prison time for those who would violate, and that mainly is the biggest challenge that has been seeing the government shifting its tone toward the punishment and imposing a full lockdown over the country. Another challenge is, of course, the health services. First, the government has been focusing on providing COVID-19 health services through only its facilities. This week, the private hospitals have been notified to set up sections of quarantine sections within their hospitals to assist in possible bigger scale outbreak within the coming days and weeks, and therefore there's a set of general preparedness. So medical wise, the challenges does not appear to be as big as influencing social distancing and abiding to the curfew.
Right, Angelo, South Africa is on a full lockdown, though, but there is the concern about what exactly this will mean for the informal settlement, because the majority of workers in Africa's cities tend to be in the informal settlement. How is it going down in South Africa?
Well, that's where the critical time bomb is sitting and ticking away quite seriously right now, because those informal settlements, those squatter camps, are essentially shack or shanty towns, people living very close to each other in really small corrugated iron homes with minimal reticulation, hardly any sanitation involved. They're public taps that people are using. So the major concern there is the social distancing issue, and that's something that the government and all the NGOs and all the healthcare workers have been trying to reinforce, is this need for social distancing. You can't have a lockdown in an informal settlement and expect people to stay in those shacks in the heat of the day, because it's just unbearable. And also people moving around on unstable environments. The healthcare situation there is very tense at the moment. The communities are trying to adhere to the rules and regulations, but it's physically almost impossible to maintain social distancing when you have between 6 and possibly 10 people living in a one-room shack. So it's a ticking time bomb. The communities are, or should I say that the health services are trying to do as much testing and education as possible, to talk about washing hands, to talk about that social distancing, to talk about the fact that if you're going to be outdoors, that you need to be on your way to go and do something, in other words, to go shopping, because that's what you're allowed to do. The military are in the environments as well, as are the police services, trying to keep people at least in stable situations, or at least not close to each other. And then, of course, there has to be masks have to be distributed, that testing has to be done. So it really is one of those really fraught environments to be operating or to be living in.
Right, and we will be exploring the challenge a bit more a little later on in the program. But for now, we'll take a short break, but do stay tuned. Talk Africa will be back with more analysis from across the continent in a moment. Stay with us.
Life moves pretty fast. Ideas move at the speed of sound. Technology moves at the speed of light. If you don't filter out the noise, you might miss the details. We pay attention to the details because they matter, showing you a different perspective. See the difference.
Welcome back to Talk Africa. On standby from Cairo, Adel Mahroui. In Lagos, we're joined by Deji Badmus, and in Johannesburg, still with us, Angelo Coppola. Let's continue with the assessment of COVID-19 in Africa. Adel, one of the issues that has come up over the last few months since the outbreak of the pandemic is the question of how much information the public is receiving. We have seen a lot of misinformation across the globe, not just on the continent. Has that had an impact at all with the public confidence, with the government handling of the situation, or with the pandemic itself?
There has been huge misinformation circling with lots of recommendations of how to treat the virus, how to deal with it, the numbers of cases reported in Egypt, where they are, what is the government doing. And the government has actually been taking surprising measures of updates, daily updates that has been taken from all government ministries. There is a daily update from the health ministry about the official numbers of COVID-19, the casualties, the death, the increase in infections and where they are. And the ministries of Interior, the ministries of Health, the Ministry of Information, they're all sending updates several times a day, and whenever there is a news circulating about certain measure, for example, Egypt will lock down entirely on Friday, then you find immediate response from the government about that, and ministries would deny or actually confirm these circulating news in efforts to curb all the misinformation circulating on social media specifically. And in terms of regulations, preventive measures, and what to do if someone suspects the virus, for instance, the government moves immediately with a unified message that is broadcasted on all media platforms, in print, in radio, on television. The same message is getting repeated all over during programs, among advertisements, so that there is actually no escape from the official response, the official statement, and the official measures that the health ministry wants the public to adopt during these coming days.
Right, Angelo, we have seen President Ramaphosa coming out in the forefront in addressing the pandemic in South Africa. Has the sources of misinformation affected South Africa's handling of the outbreak?
Well, the South African government got really creative for a change in terms of how they were going to deal with this information, because the president came out very early on and very early on declared a state of disaster, got the regulations in place, and set up a structure so that everybody in the media, to start with, understood where the information was going to be coming from, who the key point of contact was. In other words, it was the Minister of Health, and any news around the virus and around the efforts by government would come from that particular ministry and from that particular minister. So from the very start, we knew where all the official information was coming from. So any attempts, and in fact, in the regulations themselves, there was a stipulation that anybody who's found to be sharing fake news, creating fake news, forwarding fake news, was liable to a fine and imprisonment of up to 6 months. So they were very firm in the approach that they were going to take in terms of managing information, misinformation. The positive case counts, the number of people who died, would all come through via the Minister of Health. So that was a key development. And also the state broadcaster then made all of its channels available, radio and television, for broadcast of the figures, of the press statements, of the press conferences that were held by the Council of Ministers, as well as the Minister of Health. So on a daily basis, one of the two public channels on TV runs that broadcast, and it's shared by all the media houses. So there's no chance of any misinformation. In terms of sharing pandemic information, there's a website, or should I say a WhatsApp helpline that was created by a South African organization that has some 3.5 million users at the moment, and around 60 million messages that are being shared about people wanting to know information about how to test, when to test, what they should be looking for, and all those frequently asked questions that a call center would normally handle is being handled by this WhatsApp helpline. So the flow of information is very well managed, very carefully managed, in terms of where the sources of official information are coming from, Beatrice.
Right. Nigeria has had a longer time in dealing with the pandemic than the rest of Africa. What is being done there, though, in terms of managing information?
Well, I must give the government credit in terms of information dissemination and enlightenment campaign right from day one, even before the virus made a landing here. The government was massive in terms of enlightenment campaign. The only challenge we have at the moment is that you don't see a replication of this information overload, if you like, at in the rural areas, so to speak. So you go to rural areas, places that are remote, where people do not have access to electricity, for instance. People know very little about about COVID-19, and so it's one area that I think the government needs to work on. But if you talk about urban centers, I would say it's a case of information overload. Now, besides what the government is doing, we're also seeing corporate organizations, media houses are also designing their own campaigns and putting it out there. It's the level of awareness in the country is high. Of course, you still have, a couple of people who still do not believe that there's a disease called COVID-19, who would still argue. But we cannot deny the fact that in terms of information dissemination and enlightenment campaign, it's been quite massive, whether it's radio, television, and what have you. But another challenge, I should say, is social media. There is this information bombardment, deluge of information on social media, and fake news, outright fake news. And part of the problem we have also seen with social media is that, look, too many people are putting too many things out there, telling you about, a cure for COVID-19, what you need to do to get it out of your system, what you need to do not to contract it, and all of that. And most of this information are actually not correct, and they're not coming from the right sources. Unfortunately, you have a situation where quite a number, especially the majority of people living in urban centers, have access to the internet. They're reading some of this information, and unfortunately, some people are falling victim to some of this misinformation.
Very interesting discussion here, because we're going to run out of time in a short while, and I do want to get a final comment from all of you. Adel, we are not medical professionals, but we are, very briefly, we are looking at this in every, through every nook and crook, as we call it here. Just tell us very briefly, looking at what is going on in Egypt and in parts of Northern Africa, what is your assessment of the level of preparedness of governments there?
No one was prepared for COVID-19 when it first arrived or broke out from China to the rest of the world. But when it arrived in Egypt specifically, we could see the gradual improvement in the government preparedness, and the same has been evident in other North African countries, in Morocco, Tunisia and Algeria, which is showing also one of the biggest numbers in the continent. It seems that governments are learning as they go, but so far, in terms of preparedness, things are still getting up. Egypt started with having one testing center in Cairo for the virus, and then that multiplied to 21 within a couple of weeks. So there's a huge progress going on, and many governments are exerting utmost effort to allocate testing kits and allocate testing centers for the rest of the nation. In terms of information control, as you've seen, it seems that most of the governments, at least the three that we've heard about during this program, have been quite determined to dismiss all of that and have an official source that the entire nation or for each country should trust the sources of its own government. And therefore, this is another step that has been quite progressing. What we need to control COVID-19 in general is confidence in the measures that each government is taking and abidance to the regulations that is being managed by an entity that is overlooking the entire country, rather than having individuals who see quite a limited part of the picture reacting spontaneously or refusing to abide to these terms, and therefore could be silent spreaders and could pose serious risks to themselves and to their neighbors.
Angelo, what are you seeing in terms of preparedness in South Africa and the wider Southern Africa region?
Well, what's happened is that the business sector and the government sector, private and public sectors, have come together quite nicely. Government has laid the sort of legislative foundation in terms of what they're going to do in terms of policies and how they're going to help the country recover post the virus outbreak. Business has got involved in finding specific solutions to specific problems. For example, we have a shortage of personal protective equipment in the country, and the business grouping has got together and is looking and has made a call to companies in South Africa and globally, including China, for PPE that they need in the country very quickly for their healthcare providers. So that's one of the big developments that's happened. Then we're seeing lots of business people coming forward with donations. For example, we had Samsung donating around 1,000 mobile units to the people that are going to be in those testing vehicles. So that's another example of how the business sector has come together and starting to help the government fulfill what it needs to do. And then there's the billionaire set that we have in our country. We have 5 or 6 billionaires, dollar billionaires, who are all contributing to a solidarity fund and to an SMME fund, and then to general support for the government in terms of what they need financially to be able to meet their commitments. So it looks like everyone's come together quite nicely and worked together to find a solution and to actually get everything in place so that we can overcome this virus.
Right. Deji, a final comment from you, because West Africa, though, has had a lot of experience dealing with a previous Ebola epidemic in 2014. What are you seeing in terms of preparedness?
Just like you have in South Africa, the corporate world in this part of the world now has actually come together. So far, they've been able to contribute around $40 million in support of the fight against COVID-19, and it's getting better. The response is getting better. But something I want to say, Beatrice, beyond all of this, what we have seen across Africa is that it appears we are copying the system of the West. You know, what we're doing here is containment. Africa should begin to think and look inwards. It's not impossible to find a cure for COVID-19 from here, from Africa. And I think it's something our leaders have got to think seriously and deeply about. It's not enough to begin to do containment. Look, you contain the virus, it's still not gone. So for once, I must say this, that it's time for Africa to rise. It's time for Africa to surprise the world. It's time for Africa to save humanity, if you like. The solution, the final solution for COVID-19 can come from Africa. And I think African leaders should begin to look beyond this whole idea of containment and begin to spend much on research, look at the local resources we have here, and try as much as possible to drive the process to come up with a final solution for this. We should not just sit down and wait for drugs to come from abroad, for vaccines to come from abroad.
Right. We'll leave it there for the moment. Gentlemen, thank you very much for that interesting discussion. That's all we have time for this week on Talk Africa. A big thank you to our team of correspondents for their insights and the in-depth coverage of the COVID-19 pandemic's impact in Africa. Adel Mahrui is in Cairo, Egypt for us. Deji Badmus is in Lagos, Nigeria, and Angelo Coppola is in Johannesburg, South Africa. Do remember to follow the conversation online through Facebook, Twitter, and YouTube for more updates on COVID-19. And do join us again next week. For me, Beatrice Marshall, and the team in Nairobi, keep safe and goodbye.